in that case, actually, we have rupture of membranes. She had developed rupture of membranes, and that means that she had drained liquor. As you can see, the placenta is seen here is just a fundal posterior placenta, and you can see some bowing of the long bones. Of course, that's what's called oligohydramnios sequence. When she develops rupture of membranes and then the liquor is nearly drained, of course, there is what's called oligohydramnios sequence, in which the long bones become bowed by time, and then a risk of pulmonary hypoplasia starts to occur, and of course that ends in fetal death. And that's what happened in this case, unfortunately, that she developed intrauterine fetal death. And as you can see here, there is crowding of bones, and the placenta here is posterior, and spalding of the head started, which is overcrowding of the skull bones. Unfortunately, she developed this rupture of membranes 2 weeks ago without any precautions for this rupture of membranes. When there is drained liquor and she develops rupture of membranes, we are afraid of risk of infection. And of course, the introduction of infection is causing chorioamnionitis, which is a real problem. And unfortunately, also, she had this intrauterine fetal death for over 2 days ago. And so we have another risk of DIC, disseminated intravascular coagulopathy. These two dangerous conditions actually carry the risk of infection and the risk of bleeding, and unfortunately this is a very, very risky situation. Please, when you have rupture of membranes, if you are a pregnant lady, please go to the hospital immediately. Go to your doctor or your physician or whatever, the antenatal care, where you are having this antenatal care, and tell them that you had rupture of membranes, because you have the risk of infection and introduction of infection. And you have to know what is the decision. If you have the decision of continuing your pregnancy and conservation of your baby, you have some precautions for this conservation, and you have to have some lab tests, which are very important, laboratory investigations, to be sure that you do not have a chemical, or you should have the lab investigations to be sure that we do not have an active infection. And of course, when there is intrauterine fetal death, still this is a risky condition, and you should interfere, and you should go to the hospital and ask and seek for help, because still we have the risk, the very great risk of having disseminated intravascular coagulopathy.